letting the folks in right now. Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are again joining the briefing virtually to adhere to social distancing guidelines. And we'll begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everybody. Last night, we had the pleasure of watching PHL Love, a concert with so many fantastic Philadelphians to raise awareness and support for the PHL COVID-19 Fund. Thank you to the many media outlets that ran the show, the performers, and special guests. And thanks to all of you for staying home, tuning in, and donating what you can to support organizations on the front lines of the pandemic. In the coming week, we'll have more information on the generous donations that resulted from the event. Our corporate neighbors continue to show generosity during these difficult times. The professional hygiene brand Torque made a $100,000 donation to Off Their Plate, an organization that supports both the food service and healthcare industries. This donation will provide thousands of nutritious meals to healthcare workers at hospitals in the region and restore hundreds of shift hours to restaurant employees in the Philadelphia community. MANA has been meeting the medical nutritional needs of people at acute risk from serious illness for 30 years through the delivery of medically tailored meals and nutrition counseling. To support these efforts, Lockheed Martin donated $400,000, one of the largest lump sum corporate gifts MANA has ever received. Lockheed Martin's decades-long presence as a major employer in Philadelphia and southern New Jersey means the corporation's retirees, employees, and their families are linked to the long-term health and prosperity of our region. In addition to these generous donations, Lockheed Martin employees in the region are manufacturing personal protective equipment for healthcare workers, contributing to school districts for distance learning, and donating meals to frontline workers. We rely on partners in the nonprofit business and philanthropic communities to support this important work and ensure that our most vulnerable neighbors do not go hungry. I truly appreciate the work of MANA all year long and thank Lockheed Martin for stepping up so generously during this critical time. Today, the Pennsylvania Immigration and Citizenship Coalition announced the creation of the PA Immigrant Relief Fund. This is a statewide fund that will provide one-time emergency cash assistance to individuals excluded from federal COVID-19 relief programs. The Pennsylvania Immigrant Relief Fund was launched with a $500,000 gift from the Douty Foundation in Philadelphia. However, the fund has set a goal of raising $4 million by June 30th and helping 5,000 immigrants with direct cash assistance. It's in its first round of distribution. The Philadelphia Foundation, which houses the Pennsylvania Immigrant Relief Fund, distributed funds to 30 organizations across the state who are providing $800 in cash assistance to 580 individuals statewide. I extend my sincere thanks to the Albert and Mary Douty Foundation and all the individual donors for stepping up and supporting one of our most vulnerable neighbors. The PA Immigrant Relief Fund is a powerful example of how philanthropy is responding to the immediate demands of one of our most vulnerable communities. I'm sure this fund has the potential to positively impact so many immigrant residents in Philadelphia and beyond. For more information, go to paimmigrant.org. That's paimmigrant.org. Finally, today, I want to take a minute in advance of Memorial Day to thank all the men and women who gave their lives while serving in the U.S. military. I recently watched the series Band of Brothers again, and it was a dramatic reminder of the sacrifice so many Americans have made in defense of our country. And this includes Wild Bill Guarnier and Babe Heffron from South Philadelphia, who served in Easy Company in the 101st Airborne. You can visit their memorial at 2nd and Reed in South Philly. It's a beautiful and touching reminder of the dedication and sacrifice these and millions of veterans have made. I ask all Philadelphians to enjoy this holiday weekend safely and to take a few minutes to give thanks to those millions of Americans who have served us over the years. Now we'll turn it over to Dr. Farley for his daily update.
Thank you very much, Mayor. We're seeing more signs of progress against the coronavirus epidemic here in Philadelphia. Since this time yesterday, we've confirmed 309 new cases in Philadelphia residents, bringing us to a total of 21,009 since the beginning of the epidemic. Now, we received many laboratory test reports in today, which is probably why that number 309 is a little higher than we've seen in previous days. Overall, the trend is still down. We're seeing progress in our congregate settings. If you look at the graph on nursing homes on the website, you can see that decline in cases. I will point out, though, that the nursing homes are starting to do screening of asymptomatic residents. And so we will expect to see more cases in nursing home residents in people who are asymptomatic, not sick and may have had it in the past, but still have a positive test result. So we may be seeing some increased cases in the near future as a result of that. In the city's jail, we've confirmed 0 new cases of inmates since yesterday, but asymptomatic screening of inmates has started there as well. And so we will expect to find some cases there as well in the future. In our city's hospitals, as of yesterday afternoon, there were 549 inpatients with coronavirus infection in Philadelphia hospitals, and in hospitals in the region, it was 1,084. That's a definite decrease since yesterday, and a good overall decreasing trend over the past 2.5 weeks. Since this time yesterday, we've confirmed 56 new deaths from the coronavirus infection, bringing us to a total of 1,221 since the beginning of the epidemic. Of those 647, or 53%, were nursing home residents. Testing, as I said before, we have 47 test sites available throughout the city. Go to www.phila.gov/testing to find all the different sites and how you get there. And then just to talk to everyone else who doesn't have symptoms right now, we are, as these numbers continue to go down, we're getting closer to reopening. Whenever we reopen, however we reopen, there will be a new normal. That new normal will be different from how things were before the epidemic came. It will involve smaller numbers of people in any kind of interior space. It'll involve barriers between people, like those plexiglass barriers that you see around the cash register to block respiratory droplets from passing from one person to another. It'll involve spacing of people, decals on the floor that show that you should be 6 feet apart. And it'll involve masks. Masks is the one thing that you individually have an opportunity to really have control over. So wearing a mask is going to have to become a new normal. As I've said before, and I'm going to repeat many times, get a mask if you don't already have one and get used to wearing it. All the information and all of our data is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we'll throw it over to Armando for the Spanish language translations of Dr. Farley's and the mayor's comments.
Mensaje del alcalde Jim Kenney para el viernes 22 de mayo del 2020. Buenas tardes a todos. Anoche tuvimos el placer de ver PH Love, un concierto para crear conciencia y apoyar al fondo PHL COVID-19. Quiero dar gracias a los medios de comunicación que transmitieron el programa y a los artistas e invitados especiales y, por supuesto, a todos ustedes por quedarse en casa y sintonizar el concierto y por las donaciones para apoyar a las organizaciones que están batallando contra esta pandemia. La próxima semana tendremos más información sobre las generosas donaciones que resultaron de este evento. Nuestros aliados corporativos continúan mostrando su generosidad durante estos momentos difíciles. La marca de higiene Tork hizo una donación de $100,000 a Off Their Plate, una organización que apoya a quienes nos prestan atención médica y a aquellos que trabajan en el rubro del servicio de alimentos. La donación les dará miles de comidas nutritivas a los trabajadores de la salud en los hospitales de nuestra región, generando también cientos de horas de trabajo para los empleados de los restaurantes en la comunidad de Filadelfia. Por su parte, durante los últimos 30 años, MANA ha estado satisfaciendo las necesidades nutricionales de las personas a riesgo de contraer graves enfermedades, dándoles comidas médicamente adaptadas y también asesoramiento nutricional. Para apoyar estos esfuerzos, Lockheed Martin donó $400,000, una de las donaciones corporativas más grandes que MANA haya recibido alguna vez. La presencia de Lockheed Martin durante décadas como un importante empleador en Filadelfia y en el sur de Nueva Jersey significa que sus jubilados, sus empleados y sus familias están comprometidos con la salud y con la prosperidad a largo plazo de nuestra región. Además de estas generosas donaciones, los trabajadores de Lockheed Martin en la región también están fabricando equipos de protección personal para los trabajadores sanitarios y contribuyendo con los distritos escolares para el aprendizaje a distancia, además de donar comidas a los trabajadores que se encuentran en la primera línea de combate contra este virus. Dependemos de los aliados en las comunidades sin fines de lucro, en las comerciales y en las filantrópicas para apoyar este importante trabajo y para garantizar que nuestros vecinos más vulnerables no pasen hambre. Realmente aprecio y agradezco el trabajo de Mana y agradezco también a Lockheed Martin por su apoyo tan generoso durante estos momentos tan críticos. Y hoy continúan los anuncios positivos. La Coalición de Inmigración y Ciudadanía de Pensilvania anunció la creación del Fondo de Ayuda a Inmigrantes de Pensilvania. Este es un fondo estatal que proporcionará asistencia monetaria de emergencia a personas excluidas de los programas federales de ayuda por la COVID-19. El Fondo de Ayuda a Inmigrantes de Pensilvania se inició con una generosa donación de $500,000 realizada por the Douty Foundation de Filadelfia. Este fondo tiene como meta la recaudar $4 millones para el 30 de junio y así ayudar a 5,000 inmigrantes con asistencia directa en efectivo. En su primera ronda de distribución, Philadelphia Foundation, que alberga el Fondo de Ayuda a Inmigrantes de Pensilvania, distribuyó fondos a 30 organizaciones en todo el estado que están brindando $800 en asistencia en efectivo a 580 personas en todo el estado. Esta asistencia en efectivo será proporcionada solamente una vez. Y extiendo mi sincero agradecimiento a la Fundación de Arbor y Mary Douty y a todas las personas que han realizado su donativo por apoyar a uno de nuestros vecinos más vulnerables. El Fondo de Ayuda para Inmigrantes de Pensilvania es un poderoso ejemplo de cómo la filantropía está respondiendo a las demandas inmediatas de nuestras comunidades. Y estoy seguro de que este fondo tiene el potencial de impactar positivamente a muchos inmigrantes en Filadelfia y en toda la región. Para obtener más información, por favor visite paimmigrant.org. Finalmente, para cerrar el día de hoy, quiero adelantarme al Día de los Caídos o Día de Remembranza para agradecerles a todos los hombres y mujeres que dieron sus vidas mientras servían en el ejército de los Estados Unidos. Recientemente vi la serie Band of Brothers, que fue un recordatorio dramático del sacrificio que tantos estadounidenses han hecho en defensa de su país. Les pido a todos los habitantes de Filadelfia que disfruten de este fin de semana festivo de una manera segura y que se tomen unos minutos para agradecer a los millones de estadounidenses que han servido en las Fuerzas Armadas. Y esta es la actualización en materia de salud para el viernes 22 de mayo del 2020. Desde ayer se han confirmado 309 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 21,009 casos en la ciudad. Estamos recibiendo reportes de casos, pero con retraso. Y aún así, la tendencia sigue mostrando el descenso de los casos. También hay avances en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente reportamos 3 casos confirmados. Los hogares de ancianos ya están realizando pruebas en pacientes asintomáticos. Hoy, tristemente, reportamos 56 muertes por la COVID-19 en la ciudad. Hay un total de 1,221 personas que han muerto por la COVID-19. 647 o el 53% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. E informamos que hasta ayer en la tarde 549 personas han sido hospitalizadas en Filadelfia y 1,084 personas han sido hospitalizadas en la región sureste de Pensilvania. La tendencia nos muestra un claro descenso en las hospitalizaciones. Ahora las pruebas están disponibles en casi 50 centros ubicados a lo largo y ancho de la ciudad de Filadelfia. Puede ubicar el centro más cercano a su domicilio yendo a fila.gov/testing. Les alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Les recordamos que las pruebas están disponibles con previa cita. Y estamos muy cerca ya de la reapertura de nuestra hermosa ciudad. A medida que nos acercamos a la fase amarilla, vamos a tener que acostumbrarnos a normalizar el uso de la mascarilla o cubierta facial al salir de casa. Hay que recordar que mi máscara te protege a ti y tu máscara me protege a mí. Así que úsala, porque solo juntos podremos superar este gran reto. Gracias.
Thank you, Armando. We're now going to move to the Q&A portion for members of the media. And remember that we have limited time during these briefings, so one representative from each media outlet is permitted to ask questions for the first round. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those who are logged in today, of course, use the raise your hand feature found under the participants list. And when we do call on you, we ask that you activate your video if possible so that we can see you while you're asking your questions. We will now unmute reporters one by one to ask the questions, starting with Martin Pratt of Philly YPN. Hold on, Martin. I'm having a little trouble here. All right, try it now, Martin. Go ahead.
Thank you. Thank you for doing this. First question is, have the sanitation workers been tested for COVID, and how frequently?
Sorry, it took me a second to unmute. All of our workers are being advised that, or all of our frontline workers are being advised that they can attend a number of clinics to be tested on their own, and that is covered by their insurance.
Excellent. And are they given N95 masks, not cloth masks, and gloves that won't pierce, so they're not given masks?
So we have consistently said that N95 masks are going to be reserved for our healthcare workers, and at times first responders, depending on specific protocol, and so sanitation workers have been given cloth masks.
Okay. Well, my last question is, have the trucks been disinfected on a regular basis?
I believe they have, but we can certainly confirm with streets. But yes, that has been part of the protocol.
Thank you.
Thank you, Martin. Next up is Gray Hall.
Okay, hello. Thank you so much. This is in regards to Memorial Day this weekend. Memorial thing happening in person, or I'm assuming that everything's canceled because of the pandemic and most things will be virtual?
My understanding, there's no city events that are outside in the public. We're advising people to follow our social distancing policies, and wear masks when out, and not to congregate in more than groups of 10.
And one follow-up, Mayor, if I could, does that include cookouts and barbecues and people that are going to be going to the parks as well?
Well, there's no permits being issued for barbecues in our parks. Certainly, people are going to do what they're going to do. We would ask them to abide by our guidelines and keep themselves and their families safe. But if they want to have a barbecue in their yard, it's certainly their house, and they're able to do what they like.
Thank you so much.
All right, thank you, Gray. Next, we go to Pat Loeb of KYW.
Dr. Farley, 56 deaths sounds very high. Is this another case of reconciling data, or?
Yeah, this is another case of matching this against another external database, and so we pick up cases in the past.
Okay. And the Google and Apple have announced the beta phases over of their contact tracing app. Would you expect to be able to use that in a meaningful way to do contact tracing?
We're still in the process of evaluating what role those apps have to play. The users, my understanding is the users have to turn them on. And so there have to be enough people using them in order to have it be meaningful. So it's definitely not going to rely on them. This is mainly going to be a human to human activity. If an app comes forward that really can help us out, we'll be happy to use it, but that's not, central to our plans right now.
Okay, thank you.
Thank you, Pat. Now we go to Laura McChrystal of the Inquirer.
Hi, I'm wondering if you could update us on, talks with Governor Wolf's office about reopening and when that might be, if you have any more news there.
Nothing that I'm aware of at this moment. We talk to the governor's office and his folks all the time. I talk to, almost every day. I talked to the governor myself 2 days ago about the issues with PPE, but no specific conversation on reopening, quote unquote.
Okay. And is the city still planning to, I know numbers of cases per day are going down, but is the city still planning to wait until that around 50 or 55, whatever it was per day threshold to start moving to the yellow phase?
Doc, you want to take that?
We're tracking the indicators overall. The governor has his rules, and I can't say that that's a threshold that's going to happen here in Philadelphia. It's certainly not close. Our rates are a good bit higher than that. So we're still focused right now on trying to get those case rates down before we have any specific dates in mind.
I don't really think we should be going by dates necessarily, but by data and numbers. And certainly people can argue about the numbers one way or the other, but I think that the data approach to science and medicine is the best approach to keeping people safe and healthy.
And I can also say that I think that there's more than one indicator that we should be following. It's not just the actual case rate, but it's also what's happening, how many hospital beds are available, for example, and how much testing we're doing. So we're looking at a variety of metrics that says that we would be safe to go to the next step of opening.
Okay. And one last question for the mayor. You mentioned just now that you had spoken with the governor this week about PPE. What can you share about what you spoke about and, what the current shortages or?
Well, I'm looking more forward to the fall, see if we can begin stockpiling in case we have reoccurrence of COVID where we need additional PPE. I'd rather have some in stock than try to scramble for it in October, November if we have something bad happen.
Okay, thank you.
Thank you, Laura. Now we go to Natasha Brown of CBS 3. Hold on, Natasha. Give me 1 second. All right. I am not able to unmute. Natasha, can you try? Yeah, there you go. All right. Thank you.
Can you hear me now?
Yes.
Okay, great. Sorry about that. This question, I guess, is toward Dr. Farley, just in reference to the CDC warning, just about, in light of all the restaurants that are closed and things like that, warning about aggressive rodent behavior in cities due to coronavirus shutdown. So cities like Philadelphia, clearly we've seen rats and we're used to that. But just the CDC even now warning about, their aggressive behavior and telling folks to secure their businesses and their homes and keeping garbage and things like that tightly wound. So your thoughts just about this warning from the CDC for Dr. Farley?
I had not seen that warning. I can say in general, if you leave food out, you're going to have rats. That's a part of the reason why we always have rats. People leave food out. I'm not aware that that's gotten any worse with this closure than it was before. We do have a rodent control, department or unit within the health department. They're going to be working on that. There will always be some rats here, but I'm not sure that's any worse than usual.
Okay. All right. That's about all I have. Thank you.
Thank you, Natasha. Now we go to our Henny's Figueroa of Univision. Hold on 1 second. All right, try it now.
Okay. Good afternoon, Mayor and everyone. I need Armando, your translation, please.
Buenas tardes, Argenis, ¿cómo estás?
Buenas tardes, muy bien, gracias. Armando, mi pregunta es para el alcalde. Y es que esta semana se estuvo rumorando que el distrito escolar no ha recibido fondos y entendiendo todo este tema del déficit del presupuesto, quería saber si la ciudad tiene alguna información sobre esto.
My question is for the mayor. This week there's been rumors going around that the school district has received funds, and in light of the deficit that's being spoken about, does the mayor have any information on this?
I don't know what kind of funds he's speaking of.
No entiendo, Argenis, de qué tipo de fondos hace referencia.
Ellos aseguran que fondos federales, pero justamente como no he podido conversar con ellos directamente, no sé si la ciudad tiene alguna participación dentro de la transferencia de estos fondos, por eso pregunto.
I'm referring to federal funds, which is what they've mentioned, and I don't know if the city has any participation in the disbursement of these funds.
I'm not aware of the funds. We can check it out. Maybe Brian has more information.
Yeah, so any federal funds that the school district has received is around preparing for and responding to COVID-19. It is not to fill lost revenue that they would have generated from taxes or from the city's general fund.
Es información que vamos a verificar respecto a esos fondos, pero según tengo entendido, los fondos federales que ha recibido el distrito escolar son para preparar su respuesta ante la COVID-19 y no para poder subsanar cualquier déficit que tengan operativamente hablando.
Es decir, ¿no tienen todavía alguna proyección para el próximo comienzo en otoño?
En términos de...
es decir, que si esto estaría, si ellos creerían que este déficit presupuestario afectaría el comienzo de clases en otoño.
The question has to deal if you have any projections as to how this deficit in the budget may be affecting the start of classes come the fall.
Well, first of all, the classes starting in the fall is not simply a financial question. It's a question of whether or not they can open in the fall. And when we get closer to that, we'll have a better idea. But I'm a little confused as to, I don't understand when Brian talked about the funds not being able to replace any operational deficit going forward. That's why we proposed the revenue package we proposed in the amended budget in order to keep the school district from hitting that deficit. And if council passes that budget, there won't be a shortfall. If council rearranges the budget and finds revenue somewhere else, or available dollars somewhere else for the school district, there won't be a shortfall. Our budget as proposed does not have a shortfall for the district.
Primero, antes que todo, quiero decirte que el comienzo de las clases en el otoño no solamente depende de factores financieros, sino también, obviamente, de factores de seguridad, si es que se va a poder abrir clases de forma regular. Quiero decir también de que estamos cerca de obtener mayor información respecto a ello según el tiempo avance y sepamos más. Y que no tenemos nosotros ningún entendimiento, no comprendemos a qué se refieren esta donación de fondos para reemplazar un presupuesto un déficit presupuestario del Departamento de Educación. Nosotros hemos propuesto en nuestra enmienda al déficit en el presupuesto que el Consejo Municipal proporcione un paquete de ayuda, pero esto no significa que no se encuentren fondos en algún otro lugar para tratar de que no haya una caída en los presupuestos con los que opera el distrito escolar.
Okay. Muchas gracias, Armando. Es todo.
Bueno, thank you.
Thank you, Argenis. Now we go to Layla Jones of the...
Hello, hi. I have a question for Dr. Farley. A few questions. Dr. Farley, is having robust contact tracing one of the things that's important for reopening? And what kind of threshold needs to be reached with that?
It's absolutely important to full reopening so that ideally we have our case counts down, and then every case that we hear about, we immediately interview, find out who their contacts are, and reach those contacts and have them go into quarantine so they don't further spread the infection. And certainly that's our goal. It's going to take us a few steps to get to that goal. But as the case counts go down, we hope that we can increase the number of cases that we're interviewing to get to where we're getting all of them.
What specifically needs to happen in order to get to the point where the city is ready for that kind of contact tracing?
Well, there's a number of things. We have to hire some additional staff to be contact tracers. We have some partnerships in place right now with organizations that are assisting with that. We'll probably have additional partnerships. We have to get more of our information systems in place so that there's many different steps within that. But it's really it's a scale up of all those things at one time.
Okay, thank you.
Thank you, Layla. Next up is Kennedy Rhodes, of the Philadelphia Business Journal.
Hi, this question is for Dr. Farley, and I apologize if this has already been asked, but does the city have a model or projection that estimates when Philadelphia's numbers will reach the threshold for reopening that Governor Wolf has put in place?
we don't have a model for that. I mean, anybody can take the graph that we have on our website and, sort of estimate from down there as to when we'll get there. But there's nothing that we've formally put together.
Okay, thank you. That's all I had.
Thank you, Kennedy. We are now going to move to a second round of questions. And next we go back to Martin Pratt of Philly YBN.
Thank you. Brian, I wanted to clarify a couple of things. The insurance cost of the sanitation workers for getting the test taken, is that out of pocket, or is that you're saying that their current insurance covers that and there's no cost for it?
No, insurance costs and this would be those tests are covered by their health insurance, and so their health insurance would pay to have the test done.
Gotcha. And then when you said the frontline workers and masks, I need some clarity on that. Do you mean that the masks are predominantly for hospitals and not for, we'll say, like sector workers or sanitation workers?
Yeah, so N95 masks, we're still extremely short on N95 masks. So we are reserving those for healthcare workers, police officers, and even firefighters are using something that is different than N95 masks at this point. So, we are providing sanitation workers with cloth masks. We're providing our violence prevention workers with cloth masks, and our police officers, majority of the time for average interactions are also wearing cloth masks. So, we just don't have the N95s to distribute to all of our staff.
Gotcha. And is there any kind of plan in place? We know that our sanitation workers are pretty exhausted. Is there a plan in place to hire more?
Martin, it's really hard to understand you. I don't know.
Oh, I'm sorry. Can you hear me now?
I'll try it again.
Okay, I'm sorry. Can you hear me?
It's very difficult, but go for it.
The question was, is there a plan in place to alleviate the already exhausted team of sanitation workers we currently have with maybe temporary workers?
There is not a plan to bring on temporary workers. We are continuing to experience high levels of call out. And certainly if we're able to alleviate the number of employees that are calling out, we'll be able to alleviate the stress and strain of those folks who are coming to work every day.
Thank you.
Right. Thank you, Martin.
Can I jump in for a sec and just talk a little bit about masks? Because this question comes up a lot, and I think there's an important thing people need to understand, and that is that the N95 masks, because they're so good at filtering the air, are distinctly uncomfortable to wear. If people in their ordinary activities were given an N95 mask, they wouldn't want to wear it all day long. So it's actually much better for somebody who does not have an intense exposure to someone with the infection to have a surgical mask or a cloth mask than an N95 mask. So I think there's a misunderstanding there. It's actually, it's going to be better for people who really don't have to be working close to a patient as a healthcare worker would. It'd be better for them to not have an N95 mask.
Great. Thank you, Dr. Farley. And we will go now back to Laura McChrystal of the Inquirer.
Hi. Following up on my questions about reopening, some of my colleagues at the Inquirer have just published a story reporting that the governor is expected to announce that all Pennsylvania counties will move into the yellow phase by June 5th at the latest. Is that something that you all are familiar with? And do you think that Philadelphia will be ready for that by then?
So, I can say that, we'll look at it. There may be things that Philadelphia can do. If our case rates continue to go down, there may be things that Philadelphia can do safely. I think whatever we do, we want to be very careful about it, very gradual about it, and have systems in place so that we can measure whether there's any signs of increased viral activity as a result of that.
Okay, so had you heard from the governor's office that announcement was planned?
I'd heard that there was a government announcement planned later today. I had not known what's in there.
And we can't react to what has not been announced.
Okay, understood. Do you anticipate that Philadelphia will go along with whatever plan it is that the governor's office puts out?
I can't answer that question because I don't know what he's announcing. And I know there's an announcement, but the specifics of the announcement need to be known before we can respond to it, or I'd be
Sure.
for the horse.
If I could just finish my question, I guess generally, could there be a scenario in which, the rest of the state is doing something, but Philly as a city is still keeping certain restrictions in place?
It's not our goal. We from the very beginning have been working with the Southeast region. We like to walk the same route together. And once we see what exactly is being announced, we'll be able to determine what it is, how we can respond.
Okay, thank you.
Thank you, Laura. We'll go now to Claudia Lauer of the Associated Press.
Hey, how are you? I know this is well-tread ground at this point, and I apologize. I just wanted to clarify the plan for the homeless folks who are sheltering at the airport. I know that the date of breaking up that encampment, or however it's being phrased, I'm sorry if that's incorrect, but it was moved to likely Tuesday, but I wanted to double check if you have any details of how that's going to work.
The plan is to continue operations on Tuesday, and individuals will be relocated from the airport. They'll be tested, and then they'll be triaged into appropriate shelter from there.
So they will be offered transportation to a shelter if they choose to, but if they choose not to.
Well, they are not permitted to stay at the airport, and so we do. Delaware County will also be at the site as well, and so some may choose to go to Delaware County. They're also offering services. Some may choose to accept services from Philadelphia, and you're absolutely right. Some will not accept services at all, which is certainly within their rights, but they're certainly not allowed to stay at the airport from this point forward.
Okay, so the plan is for the airport to start enforcing, moving them, if not helping them get somewhere, which they're being offered on Tuesday. But, if they choose not to stay, the airport will be asking them not to be in the terminals.
Correct. So the airport issued a regulation 2 weeks ago that was to go into effect on Friday. That would people with airport business would be allowed inside the terminals. And so they'll be, again, enforcing that regulation on Tuesday. They delayed enforcement at our request.
Okay. And testing starts on Tuesday, or it's being done over the weekend?
I believe should be being done on Tuesday.
Tuesday. Okay. Thank you.
Thank you, Claudia. And finally today, Pat Lowe, back to you for KYW.
Thanks. Dr. Farley, how many tests per day is the city doing now?
It's probably closer to 1,600 than it was to 1,500.
Okay. And then I think this question is for Mike more than anybody. For our planning purposes, the state briefing is at 4 p.m. If Dr. Farley and Mayor Kenny won't comment now on what's expected to come out of that, how will we be able to get their response after 4?
You could email us, Pat, and we will provide a statement.
Thank you.
Mm-hmm. And that concludes today's daily briefing. We do note that the city will not be holding a COVID-19 press conference during the Memorial Day weekend. Press releases will be issued on Saturday, May 23rd, and on Monday, May 25th. No press release on Sunday. And the press conferences will resume on Tuesday, May 26th. Thank you. Until then, have a safe weekend. This concludes the briefing.